Congressman, you had said that you'd heard rumblings among some of your Republican colleagues about these Medicaid cuts. 33% of Eli Crane's constituents are Medicaid recipients, 26%, as I pointed, of Mike Lawler's from New York, 37% of Dan Newhouse's constituents in Washington, and 62% of David Valadio's constituents in California are recipients of Medicaid. In addition to that, lots of Republicans are working class. Lots of Republicans buy things and don't really want the government telling them how many dolls they can buy and how many pencils they can buy. Tell me about these rumblings. Are they enough that, because it doesn't need a lot of Republicans to say, stop the nonsense?
Well, let me say, if we had more members like Charlie Dent there with us, we could work these problems out. And there are a few of them within the Republican caucus, but most of the people that you just mentioned are so wed to Donald Trump, I can't see them changing. And yes, the Medicaid cuts can devastate rural hospitals where there is already a problem, can devastate many people that rely on it. Even here in a prosperous city like Austin, Texas, my home, half the babies that are born here rely on Medicaid to get access to a physician. And so they're going to have to decide whether to accept those cuts. I know there are rumblings within their caucus, but when it comes to voting, it will be a question of whether, almost as Charlie said before our break, they're forced to walk the plank for measures that the Senate will likely reject in the future. I hope some of them will hold back and will refuse to join this, but this is the big day of decision. All three of the key committees will meet on Tuesday afternoon and begin this process of cutting. I actually expect that ultimately there may be enough grumbling and pushback that they will simply decide to borrow more money, which is what's led us into the tremendous national debt that soars that we already have, that they've condemned, but may well choose as the easiest way out.